long-term proton. Hello, this is Jaimie Tahir, and I'm here to present my DNP project entitled Evaluating Long-Term Proton Pump Inhibitor Use Among Long-Term Care Residents. Let's talk about a little bit of how this project came about. So in the early year of 2020, around January, February, we had a corporate meeting, and the administrators and the corporate people met with all the providers, and they asked us to review all the patients' medications, particularly in the long-term care side, to see whether there are any medications that we could discontinue because they are taking so many medications. So we have identified a lot of unnecessary medications among these patients, but for this particular project, I only focused on how to de-prescribe proton pump inhibitors. So the entire duration of this presentation will be talking about what we did and how we took patients off the long-term proton pump inhibitors. So in background, we know that the proton pump inhibitors in the likes of omeprazole, there's pantoprazole, there's so many others, esomeprazole, the Nexium. These are the proton pump inhibitors. They remain the foundation of treatment for both GERD treatment, and there's erosive esophagitis, ulcers, and can also be used for symptom relief and healing of duodenal and gastric ulcers. So it has been a main treatment of this disease. And the use of proton pump inhibitors actually increased significantly over the years since its introduction in the market since 1980s, particularly the omeprazole. And why are we very concerned about that? Because its association with increased long-term use has posed a lot of adverse events among patients, particularly among the elderly people. And there is an increased risk of pneumonia, there is fractures and hypomagnesemia, there's increased risk for Clostridium difficile, there's B12 deficiencies, chronic kidney disease, and dementia, among others. There's so many adverse events that has happened over the years based on research. And additionally, with the increasing age of this elderly population having multiple comorbidities and its concomitant use with other medication, it puts them at greater risk for adverse drug-to-drug interaction or adverse drug events. And this is why we're very concerned about the long-term use of proton pump inhibitors. So for the results of the project, we used a paired z-test to compare the means of the two measurements taken at the same individual at two different times. We have the pre and post intervention phase. There's only a need for 18 sample size to provide an effect of 0.4 and with a significance of 0.5 and a power of 0.8. So that's with the help of the university statistician. I was concerned that I only have 21 subjects for me to use z-test, and he said that we only need 18 samples, which I was able to provide. The constant proportion is 0.5. The achieved power of the study is 0.98. And we have used the upper tail test for us to elicit the scores, and the upper critical value came up with a 1.6449 and a p-value of 0.001, which is less than the significance level of 0.05, indicating evidence against the null hypothesis. So how do we define long-term use of proton pump inhibitors? That's the one main questions that are being asked, like what is long-term? So long-term is actually taking it more than recommended, basically for healing to occur for reflux, ulcerative duodenal ulcers, or we have esophagitis. Typically it takes about 6 to 8 weeks and as long as 12 weeks to heal. And after that, anything longer than that is already long-term. So, and these patients in this facility have been taking it for years. Like at the time of my review with the patient, they have been taking it for more than a year. And some of them already got admitted to the facility, and they're already on the medication for years, and they don't even remember when they even started it. And the only diagnosis that these patients have is GERD. No other bleeding disorders, Barrett's esophagus, and all those things that would really need for them to be on long term. So there's basically no evidence of continued evidence of the necessity to use it for more than recommended. So the main objective of this project is to help minimize polypharmacy among long-term care patients. So again, for this project, I only focused on how to discontinue proton pump inhibitors without fear of symptom relapse. And the goal is to safely deprescribe them from proton pump inhibitors, and especially those patients who have no clear indication for continued use. What's the design? We used the quantitative exploratory design. We did retrospective chart review of at least 50 electronic medical records of the patients, and to evaluate how effective it is to deprescribe them, or the process of deprescribing among long-term care patients. And what can we do, and how could we go about with taking them off these medications? What are going to be the challenges that we will face in taking these medications that they've been taking for years? So the research question, or the PICAT question, is: are lifestyle, dietary, and positional modifications safe alternatives to maintain GERD-free symptoms among long-term care patients over a 4-week period of deprescribing the proton pump inhibitors? So we observe them for the duration of 4 weeks and see if they have symptomatic problems, or if their symptoms are going to get worse, being off the medications. And during this period of time, we incorporated lifestyle, dietary modification, and we also taught them how to do their positioning, and we gave them pamphlets on what to do during the process of being off the medications. So as a brief conclusion, later on we'll go into the details of how and what happened during the time of the deprescribing. But actually the conclusion is that the project corroborated with the use of non-pharmacological intervention in the form of lifestyle, dietary, positional modification. They actually proven to be effective alternatives, alternative approaches to maintain GERD-free symptoms among patients taking long-term proton pump inhibitors that are having no clear indications for continued use. So basically, if their main diagnosis is just GERD and there's no other life-threatening identification, medical history, in the form of like Barrett's esophagus, chronic bleeding ulcers, if they don't have those kinds of diagnoses and they only have GERD, we have used dietary, lifestyle, and positional modifications to help them maintain GERD-free symptoms, and it actually worked. And the impact of education was found to be very effective among these patients to help maintain GERD-free symptoms, especially during the time that were taken off the pre-PI therapy. So it was a 4-week duration of trying to observe them utilize the non-pharmacological intervention. So as mentioned earlier, GERD is a chronic and common upper GI problem with an increased incidence in 10 to 20% among European and American countries. And there is a strong link or relationship between long-term proton pump inhibitor use, or PPI use, and the adverse clinical outcomes in terms of rehospitalization, mortality, and loss of ADLs among elderly people. The specific aim of this project is to eliminate possible adverse event or complications among elderly people. The project is a quality improvement project aimed at minimizing unnecessary medications among elderly patients. This is also to help them optimize their quality of life. It really affects patients if they have too many medications to take, and increases their compliance too, and satisfaction with their stay in the long-term care facility by minimizing their pill burden. So if they don't really need it, if we could take it away from them, it increases their quality of life and their compliance with medication regimen. So with my review of literature, I used Cochrane, Sinol, PubMed, Science Direct, Midlane, and ProQuest. These are some of the areas that I went to look into literature to help me, or to guide me on how to go about with this project. And the studies were all in English language. Okay, the research method design is a quantitative exploratory design through a retrospective chart review of patients who are admitted in the long-term care area of the building, and to evaluate the effectiveness of deprescribing or stopping proton pump inhibitors among the long-term care residents, while incorporating the non-pharmacological intervention to help maintain GERD-free symptoms. So this is the actual pamphlet that we gave out to the patients who are part of the project. So they were reading onto it. So this is their only tool, the educational tool that we have. But of course, we gave them some in-depth education during the process, but they have this guideline for them to really be able to look into it easily with pictures so that they could really follow the instructions properly. For my data collection, this is a 90-bed capacity skilled nursing and rehabilitation center, and it's a non-profit skilled nursing facility, so it has the skilled side and the long-term care side of the facility. So this project was actually done on the long-term care side of the facility, and data was collected between June 10, 2022 to August the 10th, 2022. The data were abstracted from the EMARs, composed of 60% Caucasian patients and 40% belong to the other ethnic groups, and basically they're all adults, you know, and the minimum age to be included is 20 years old, but for this project there's no 20 years old. They're all in the 60s all the way to 90 years old, and all genders are included as long as they meet the inclusion criteria. And patients with documented diagnosis of GERD and who are taking long-term proton pump inhibitors are included in this test. What's the statistical analysis of this project? So we used the SPSS statistical software, and with the help of our dear university statistician, Dr. Paul. So he helped me compute my findings, and there's a power of level significance of independent variable was also determined in the post hoc, and descriptive statistics were reported for frequency and percentage. And we also used the paired z-test of the pre and post test scores using the upper tail test to determine significance of the study. And then the questionnaire that we use to do the questionnaire, to do the survey, is the modified GERD test tool for us to come up with our scores. So what are the results? So out of 50 EMARs that were reviewed, only 21 were eligible to be part of the project based on their inclusion criteria. And the largest population of this of the subjects belonged to the age 80 to 89 years old, and 47 of which were females. Okay, they belong to the female population. And out of 21 eligible samples that were included, only 19 patients actually responded or had a positive response to the non-pharmacological intervention, which are the lifestyle, dietary, and positional modifications. So they all responded to that to manage GERD-free symptoms, to maintain GERD-free symptoms, with a similar score of 20 from pre and post phase. So with pre and post, they need to have at least 20 scores. Meaning to say, while they are on proton pump inhibitors, they're having relief, and we took them off the proton pump inhibitors and we made them apply the non-pharmacological intervention, and they still had similar scores. So they did not have any problems. So out of that, only 2 showed significant adverse symptom relapse, that we had to put both of them back on proton pump inhibitors because they did not respond to the antacid, they didn't respond to in-demand PPI therapy, Maalox, and any of anti-reflux problem. They didn't respond to that, but to have to put them back on their previous regimen. and there's only 2 of them who did not respond. And they were also referred to have an EGD, but they refused. They said that they just want to be back on their medications. So we have a constant proportion of 0.5. The achieved power of study is 0.988747. And then we use the upper tail test, which is the upper critical value of 1.6449 and a p-value of 0.001, which is less than the p-value of 0.05, indicating rejection of the null hypothesis. Let me show you. This is how we did the analysis. A null hypothesis is 0.5, level of significance 0.05, number of items of interest 19, so they are the ones that responded, and then sample size 21. So I'm looking at here because I have a bigger screen on this right side, so you can see my face turning. And next slide is we have the upper critical value of 1.6449 and the p-value of 0.001, which is less than the significant level, and there's a sufficient information to suggest that the ratio is greater than the given standard, and the achieved power of the study is considered high. Go to discussion. Let's go to discussion. So the most common definition of long-term use, as mentioned earlier, is the use of proton pump inhibitors or PPI therapy for more than 8 weeks or greater than 6 to 12 months. So if you have a patient who are taking these medications for longer than 12 months or 8 weeks, we have to try to review the reason why they have to take it. Maybe you can try to apply the non-pharmacological intervention and try to deprescribe the patient from it, as long as they don't have a clear indication for continued use. And education was found to help maintain GERD-free symptoms among these patients, like the pamphlet that I've shown earlier. That's they're told that they can look into it in case they forget what to do, what their positions, what food they need to avoid, so they can go back to the pamphlet and look into it for a quick guideline. And there's an ongoing education that needs to be done to enhance medication safety by minimizing polypharmacy among long-term care patients, particularly the elderly people whose pharmacodynamics and physiological ability to metabolize drug is reduced. It will also increase their medication compliance, minimize drug-to-drug interactions, adverse drug event. We could also help reduce their pill burden, and this can significantly improve their quality of life as well as increase patient outcomes. So the result of the project suggests that lifestyle, dietary, and positional modification actually help them maintain GERD-free symptoms during the intervention phase. So for the limitation of the study, I have a small sample size of 21, although university statistician told me that I only need 18 for me to be able to use the paired Z test. And I also garnered a 90% response rate, which is 19/21 response rate. But given that it's only in one facility, it may not be considered applicable to a larger population given my small sample size. And there were no previous quality improvement project in the facility that I could compare my results from. And lastly, I had to shorten my intervention phase from 8 weeks to 4 weeks. Originally, I planned to do the intervention for a duration of 8 weeks, but the facility unfortunately caught a COVID outbreak, which caused the manpower to be, lessened. And 12 of my 21 samples caught the COVID infection. So I was worried that they will get sick or be prematurely discharged from my study, so I had to shorten it to 4 weeks. But luckily, even after the 8-week period, there were no other additional symptom relapse that was reported by the staff. So I have maintained my 19 out of 21 even at the end of 8-week period. So what's the implication for nursing practice? So we should have a periodic medication reconciliation, especially during admission of the patient into the long-term care facility. Due diligence. Review all their medications, see if they need to be on this medication for a long time. And then practice patient focus, centered focus medication review, like what do the patient really need? Do they really need to take this medication this long? And things like that. And then similar strategies can also be employed to other potentially inappropriate medications. And it can be deprescribed completely, or it can be given a medication holiday approach. So patients usually apprehensive to hear the word discontinue. So if you can give them the word, let's give you a holiday, and they would probably allow you to take them off from a certain medication. Yeah. Indication for future research. So the quality improvement project showed that an average of 42% admitted in the long-term care facility were taking proton pump inhibitors unnecessarily. And the findings and recommended strategies to minimize PPI overuse must be considered in the context of the population studied. The project validated the use of non-pharmacological intervention in the form of the lifestyle, dietary, and positional modification as alternative approaches to maintain GERD-free symptoms after discontinuation of the proton pump inhibitors, without fear of any symptom relapse. That ends my presentation. My name is Jaimie Tahir, and if you have questions, please feel free to put your comments in the box. Thank you.